Hi, friends. It's Dr. Ajwa. Glad to have you back here. So, light a candle, grab some tea, and let's talk about when the doctor becomes a patient. And I'm talking coming from the experience of having been a patient myself recently. And I want to give you a few tips on how you can then make the most out of your doctor's visit. So, the first thing I'll say is that when you are going to see the doctor, you want to make sure that your concerns are limited to about 1 to 3 things that you're going to bring up in that one visit, because a lot of times a few things might have to be done to work up every single complaint. So if you go into your primary care doctor, you can say, I've had trouble sleeping, maybe my stomach has been hurting. And those are two things that they'll try to figure out. But if you're talking about so many different parts of your body, head, shoulders, knees, and toes, it's a lot to keep track of. And you want to make sure that you get the most thorough workup. So, in my experience, it's best to focus on 1 or 2 things during each visit. Not to say that you can't bring up other things that are happening to you, but you might find that your doctor says, well, what is the thing that's bothering you the most right now? And that's what they're going to focus on during that visit. And you come back for another one and you do a little bit more of a workup, you do some more tests. Another thing that I will say is that when you go to the doctors, you might do a little bit of research on your own. You might have some thoughts of what's happening, and you may have some questions. Bring all of those with you. Come prepared for your visit. I'm not telling you to do homework, of course. We're there to help you figure out what's going on. But if you have a couple of questions that you want answered, write that down, because you might find that you go through a visit, you sat down, you talked to the doctor, they're telling you what they want to do, but you had another question and you leave and that was never answered because you were so overwhelmed with the information that you got, or you just got flustered, you got stuck, or you just forgot. And then you leave feeling like, oh, I didn't get what I wanted out of that visit. So write the question down before you leave from the doctor's visit. Take a quick look at your list and say, all right, do I have all my questions answered? Literally, that is what I do myself. And like I said, when you're going to the doctor and you're telling them about what's going on, it's okay for you to say, hey, I'm wondering if this could be happening to me because of X, Y, and Z. If you say, I read this online, we're not going to roll our eyes or anything. We know everyone's looking at things online. You're looking at me online. I'm a doctor trying to provide you with a little bit of information to help guide you as you're learning about your own self and your body. So it's okay to come with some ideas of what's happening. There might be things that we may not even think of that you bring to mind. So I encourage you to do that. Another thing that you should do when you go to the doctor's office is to think about, once you've gotten your treatment and you've started that treatment, is that treatment effective? Has it worked for you? Are you having any side effects? Bring that up to your doctor the next time that you go see them. And if the side effects are really bad, let them know, even if you have to make an appointment for a lot sooner than you initially planned. So if you were planning to see them in 2 weeks, but you're having a really bad side effect in the moment and it's not quite emergent, but can't wait till 2 or 3 weeks, reach out to the doctor's office, try to make another appointment. A lot of doctors have it where you can message them or where you can leave a message for an assistant so that they can call you back and guide you through whatever you're going through. And again, if it's a really, really bad reaction to a medication, get immediate attention. People have allergies. There's a myriad of things that can happen with meds, with your treatment. Go to the emergency room so you can get stabilized. And that is not to say that all meds are bad and you have to worry about them. But again, it's something that can happen. Just like if you eat food, anyone can have any reaction to a food. If you find that you are going to a doctor and they're giving you a treatment and it's not effective, also voice that. I recently had the experience of going through a lot of pain because I injured myself and I needed some pain medications. I received some, but I felt like it wasn't enough. Going back, telling the doctor, hey, this isn't working. Is there something else that we can try? Is there more that we can add? Is definitely within your right and you should do. In my experience, I went back to the provider and said, you know what? This treatment wasn't effective. Can I get some more? And I was told no. I'm a doctor, and they told me no. And every provider might have their reason for why they may not switch your medication, give you more of a medication. I don't want to make any judgments about people, but I felt after that second time of going to that emergency room, I wasn't being helped. So I wasn't going to go there again. I was going to seek treatment elsewhere or try to do something else that would help relieve my pain. So you are definitely within your rights, and you should do that if you feel after a while that where you are getting treatment isn't beneficial for you. Go somewhere else. Don't stay, don't suffer, and don't just completely avoid getting help whatsoever. And then I will say another thing that you can do if you are going to your doctors and you feel like, you know what, I feel like I'm not able to bring up all of my concerns. Have an advocate, whether you're going to an outpatient appointment or to an emergency room or you're in the hospital. It's okay to have family and friends present. Initially, the doctor might say, I want to just talk with you, the patient alone, for privacy, give you a chance to talk to us. But it's okay to have someone else there to say, oh, they would like to share something with you, or I'm okay. And that person might be your advocate, especially in cases where you are even too weak to speak up for yourself. Sometimes you could have an incapacitated mental state. That's why we have healthcare proxies. That's essentially what that person is. They're an advocate for you. But also, sometimes you might not feel comfortable saying to the doctor, I don't feel like this treatment is working for me, or I disagree with this plan of care. And it's easier for someone else to speak on your behalf. It's a lot of times easier for us to defend others, to speak up for others, than it is for ourselves. So that's where having a trusted family member or friend can be beneficial. Also, if you don't have that person or you don't want to have your closest contacts knowing all the intimate details of your health, you can also ask for a patient advocate that hospitals have. You call patient services, they can bring a patient advocate, patient liaison, they're called different things, but those people can speak to the doctor on your behalf. You can share your concerns, they'll reach out to us doctors to come and talk to us. A lot of times I will even tell patients it could be helpful because sometimes, honestly, you and your doctor may not be vibing, and that's fine. That is just life, and it's not like that. And again, we are treating patients completely professionally, neutrally, but there might be something lost in communication, and that patient liaison can help us get to a common point so that we feel like your needs and concerns are being addressed, and we feel like we are able to provide you with the best treatment possible. Those are a couple of tips for how you can make the most out of your doctor's visit. I hope it helps, and I hope you have a great rest of your day. If you're going through any illness, if you know of anyone that is suffering from illness, please share this video with them. And thank you for joining me here today. Bye.